welcome back to another segment of Breaking the Chain with Caitlin, a digital story vodcast. Each episode, we explore unique roles of various healthcare workers relating to infection prevention and control practices. I'm your host, Caitlin Cosgrove, and today we'll be talking about performing a risk assessment from a student perspective. So now it's time to welcome our guest, Czarielle. Hi, Czarielle, and welcome to the show.
Hi, Caitlin. Thank you for having me.
So to start us off, maybe you can introduce yourself, tell everyone what program you're in or anything else you want to include.
Sure. Hi, everyone. So as Caitlin said, my name is Czarielle. I'm a fourth year Ryerson nursing student. I'm graduating this year. I started off in the at Centennial campus for the first 2 years. And now I'm a Ryerson finishing off. I am in fourth year. I just finished off my clinical placements. I'm in the ICU right now, consolidating. I was on a surgery unit last semester, so I was very fortunate with my acute care placements. And I'm just excited to be here to be interviewed by you today. I hope that it helps.
I'm excited too. Thank you for sharing. And you're almost done, so congratulations.
Thank you.
So as a nursing student, how do you maintain competency in infection prevention and control practices?
That's a great question. So first and foremost, prior to you knowing everything that is, specific to your placement, know your PPE, your order, your, things that you're tested on in year one, the gown, gloves, masking. Remember, give yourself acronyms, be very confident with that on your own personally. And then, so you're tested once, and then you might not be in practice or you might not have clinical practice, but I would find opportunities to work where, now that we're in the pandemic, you're going to be wearing your mask and PPE that we wouldn't normally wear, but finding opportunities to work in these settings, because then you will be gowning up and then you will be using these skills. And then when you are in placement, when you are in practice, or you do happen to have a healthcare job, there are so many out there right now. Companies should have a PPE policy. So reviewing policies for PPE, first review the information that you have from class and make sure that's solidified. So, go back to your Potter and Perry and all these health assessment checklists, these extra checklists that they have in the textbook that you use to study, and then review the placement policies, because sometimes there's additional PPE for certain things that you might not experience depending on where you're placed. Like, let's say there's an outbreak on your unit and procedure would say contact droplet, but then they have additional precautions that are taken on top of that, or additional special procedures, not necessarily conditions, but procedures that need additional PPE, even though your patient is just a contact patient, for example. So make sure you review the policies specific to where you're at, because these vary placement to placement. I've seen this from where I work to where I'm placed now, depending a little. Right now it's a little more consistent with COVID, but sometimes there's little nuances that you'll catch just if you never know. You'll one day look into the policy and you realize, oh, I didn't know I actually had to be wearing an N95 for this procedure. So for example, I can say that going into practice, I didn't know that it's COVID right now. So for regular COVID patients, the precautions are contact droplet. So that would just be a regular surgical mask and face shield, and then your gown, your gloves. But if your COVID patient, or your patient, even non-COVID patient, has an aerosol generalizing procedure, so an AGMP, then you would have to switch to, that would be an airborne procedure. And so you would need to switch to an N95 regardless of your patients. The protocols, the PPE protocols for your patient. And another thing is, so there's AGMP procedures. So one of them is suctioning, like open sections. Another one of them is patients who are on BiPAP. So even though they may not need PPE during the day, If they have sleep apnea at night, they use a BiPAP CPAP machine, that's considered an AGMP. And so when you enter their room at night, you should be using an N95. A lot of, sometimes you might think, oh, they're not on precautions, but especially now during COVID, when these procedures are done, patients being suctioned, intubated, that's another one, then you need to switch out your PPE. So even with one patient and you think their condition is just one type of precaution, it changes depending on the different procedures that are done. And so that's something that I learned, and it would help for you to look into policies and just be familiar with that. It's not just specific to their condition, but what will be going on and what you expect to be involved in with wherever you're at.
That's a really good point, because especially like I remember as a first year student, and like you mentioned before, we did testing for hand hygiene and PPE, donning and doffing. A lot of the times you think, okay, I got to prep for this test. No, this is ongoing learning. It's not just a one-time test we do in class. No, this is very relevant to clinical. It's something, like you said, there's many nuances. There are different things that you've probably learned, like all the different examples like COVID-19 that you shared with us, that there's specific additional precautions for each. And so always like updating our knowledge on that, and reading the literature. So when students are navigating through, if it's their, like the different types of information they have, what are main key takeaways that students should look for related to infection prevention and control?
So now, and regularly, but especially now, look for safety for the client, the healthcare team, environment, and self. This is so important now because when COVID started, they started doing protected code blues. So normally it would just be a code blue situation where if a patient goes into cardiac arrest, it's the patient's life first, patient safety first, and you would go in, start compressions right away, and you would start intubation, etc. And then because you want to preserve the patient's life first. But ever since COVID started, you also have to maintain safety for the healthcare team. So it's called protected code blue because you make sure you have PPE first. So they won't jump in right away for CPR, compressions, intubation, until the whole code team has proper PPE, extra PPE. They'll have, some of them will have respirators. Make sure you have your N95, and only then will they jump in. So that's something, safety for the client, but more importantly, especially now, safety for the healthcare team, because who's going to be there to take care of them if you don't look after your own? And there's policies and procedures in place, but at the end of the day, you are the one most responsible for upholding these policies and making sure that you're donning and doffing properly. You're using and you're demonstrating proper hand hygiene. So there's a lot more hand hygiene audits and PPE audits on units now because of the pandemic. And so they're there, but that's random. And so at the end of the day, you're not there to, you're not just maintaining proper PPE when there's someone watching you, because this is your life at stake. So make sure that you know who to go to when at your placement or wherever you're working, if you have a concern about infection prevention and control. So more often than not, this will be the infection prevention and control committee at the hospital. So every acute care hospital that I've been at has an IPAC committee. That's what we call it. And so know their number, know occupational health as well, in case you do end up, you end up in a situation where you breach IPAC policies and you may come into a contaminated client, or your PPE wasn't on properly and you had some fluids spill onto you, you accidentally injected yourself or something like that. So know IPAC, know their policies at your unit, and know your occupational health, and contact them if you're ever unsure about coming into contact, or they'll contact you. And if you ever feel unsafe or think that this one patient might not, you feel unsafe, or you don't feel like you want to take extra precautions for PPE, you can have a conversation with IPAC. They're very responsive to that, especially now during the pandemic. So it never hurts to ask, it never hurts to question. and always follow best practice guidelines as best as you can, and be be vigilant for yourself more than anything else, because you're the only person looking out for your donning and doffing PPE on a regular basis, because you never know. So for example, when patients go into the ER, or the patients they have admitted into the ICU, they come straight from the ER, and more often than not, their clinical condition has deteriorated so much so that they need to be transferred to the ICU first. So the COVID swab results are still pending in the ER, but they need the ICU bed because they need, they're on a ventilator and they need to be on vasopressor, so blood pressure maintenance medications, because they're just desatting in the ER and they don't have the capabilities to maintain that patient there for long. So what they'll do is they'll send the patient up first in the ICU, and then that's pending COVID. So a lot of the times you'll see a lot of patients in critical care units and acute care units who are pending COVID. So it's pending COVID status. And so while you're waiting for the results and providing care, they're put on contact droplet precautions, but sometimes you're doing procedures in there. And so some nurses will take extra precautions, and, they'll put on an N95. And, one time there was a patient who was pending COVID or was admitted, was swabbed after the admission. And then it was found out a week later that he was in fact positive, but the IPAC wasn't up to date while he was on the ICU unit. And so that nurse and that other student that was in the room was exposed. So sometimes with granting PPE availability and recommendations from your manager, it never hurts to take the extra precautions, especially now during COVID. So if you had just worn an N95, then even though the test results came later, you would have protected yourself. And so that's how you prevent these outbreaks. You take the extra precautions and you're extra vigilant with the routine precautions. Hand hygiene always. You might get, another key takeaway is, you might feel tired. You might be tempted to just go in and say, oh, like I'm just picking up one thing. I forgot something in the patient's room. And I don't want to gown up, and I don't want to put on all this PPE because it's such a waste. But again, at the end of the day, this is your life and this is your safety that you're looking out for. So a lot of the times, and this has become more common from what I've heard from the ICU nurses and what we currently practice now in the ICU, is we cluster our care. So it's not necessarily something that you learn in practice, I mean, in the textbook, but in practice, you can give medications within a 1 hour time slot, or half hour, depending on the policy on your unit and whatever is safe, for certain medications, of course. And so you take, since many of the patients now are on precautions, what an extra task that's added at the beginning of your shift is, you think about it and you're like, okay, my patient is on precautions. They have med schedules for this time, and that time. I have assessments to do at this time, that time, and that time. What skills and tasks can I cluster so that I, minimize the amount of times that I'm exposed to this patient while still maintaining safe practice? So if you have meds at 12 and you have an assessment at 12 or 12:30, you can do that at the same time. That way you minimize the risk and you reduce your risk of exposure, but you're still maintaining safe practice. And so this is one practical tip that I learned while I was in the ICU, because yes, it is a lot of work to be going in every hour, donning, doffing PPE, especially in the ICU when assessments are hourly. But you do the best you can to cluster your care. And so regarding that, so never feel like it's such a hassle to put on all this PPE. It will be, you will feel that. You'll feel like, oh, I'll just put on a glove because I'll reach over and I'll grab that thing. But think about how, think about your priorities and whether that can wait for another cluster, and make sure that you always wait until you're ready. Make sure you have all your PPE on, and yeah, that's really what I can, and have someone to keep you accountable to. And if you see someone else, don't be afraid to say, hey, I think that you should put this on, because you're also looking out for them. So that's what the nurses on are. There's never been, thank goodness, an outbreak on the unit that I've been in. It's because the nurses have been so diligent with that, with these practices. And that's a testament to it, that there has been no outbreak, because they have been very, very, very strict with their PPE.
Yeah, wow. Thank you for sharing.
Yeah.
I really like that clustering tip, because I know a
Yeah.
lot of students, if they're working with someone on isolation precautions, that they sometimes they feel they go in and out a lot, but like taking that, step back and thinking from a time management perspective, how can I cluster certain tasks in a safe manner that will reduce that risk of exposure, and definitely, like you mentioned, thinking about not only the safety of your client, your team, but also yourself too, because at the end of the day, you have that accountability to ensure that you're following all the correct protocols. So with all this information, I'm sure the viewers are now probably wondering, what resources do you use to further develop your knowledge and skills?
Great question. So the number one thing at my placement, and in general now that I've been using, is the policies at my workplaces. So whether it be my placement or the hospital that I work at, I check and I make sure that I know what is different, what are the consistencies. Policies have been changing so fast. PPE guidelines last year are so different from what it was this year. So I always have to make sure that I'm checking, because there's additional things that are put on, new procedures that now you need to wear an N95 mask for that previously you didn't. Refer to your institutional policies with the AGMPs, aerosol generalizing medical procedures, because those are on top of your patient's regular PPE precautions, and then provincial guidelines. So referring to Public Health Ontario always, because that's often what informs your placement and institutional organizations about how they're going to have their PPE as well. So for example, public health, especially with COVID, contact droplet, and what the recommendations are for that. If sometimes you're not sure, or you're working for a small clinic, and they might not have the most up-to-date policies, it's always safe bet to go to Public Health Ontario or provincial guidelines. Regulatory bodies, so like CNO, the College of Nurses of Ontario, nursing, OT. There's for respiratory therapists as well. So sometimes you can refer to them, because often they're the ones, this is what I was surprised to know about. They're very well versed in this, because they're the ones assisting with the AGMP procedures, and they're the ones doing the ventilators and the respiratory stuff, especially related to COVID. So asking them as well. And even professional development groups like the RNAO, because in the middle of the pandemic, sometimes what their recommendations are might not align with provincial guidelines. So they might say that, for example, COVID is actually airborne, and it's listed as contact droplet, especially in organizations, because this is what the current policy is, but this is not what's recommended by these professional development groups. And they are informed by research, journal articles, and best practice guidelines. And so this is what they say. And so you might be confused, and you might think, okay, so what is it? But especially with something that's so new, and with other conditions like MRSA, and that's pretty much established, and that's contact, and there's general things that about. But for things that are new, always use, on top of all these resources, always use your judgment about what you think is safe, because you're all nurses, you're nursing students, and so you are here developing these critical thinking skills, and assessing safety of situations in yourself. And so it's expected that for yourself, you would be making the best decision that you think is right, as informed, not just from yourself, but as informed by provincial guidelines. So what they say, professional development groups that you may like, the RNA, or the Registered Nurses Association of Ontario. And then you can go into the RNAO's best practice guidelines, and the newsletters that they sent out with recommendations and practices, and often they'll reference research journal articles. So you can go into nursing groups, you can go into CINAHL. CINAHL is a research database, Medline, Ovid, these databases. And as a Centennial student and as a Ryerson student, you would have access to these through the Centennial College Library. So you just sign in through your account, you search under databases, and then you can, if you're ever unsure, you really want to look into the research of it, which we all should, you just search up research and PPE practices, and then you'll find a bunch of articles, especially now a year into COVID, about all these policies about AGMPs, procedures, and often they'll be similar, but there will be inconsistencies. And so always taking all this into consideration, you now you have this body of knowledge. Now you make the best judgment and call for yourself, because when you're in practice, you have all this information that at the end of the day, you make that final call. So you have this IPAC procedure, and there's research that says this, but you're the one going into the patient's room. And so you make that judgment about what you're going to put on and the proper way to do it, and ensuring that you do that properly. So if that helps, but yeah, that's what I've done, and so far it's gotten me through. So I hope that helps.
Wow, no, thank you for sharing, because I know a lot of times students, we have to do our due diligence in further developing our knowledge, but yeah, we never know where to go. So thank you so much for sharing all those different resources. And I guess the main takeaway really that I'm getting is that you need to do your due diligence to learn about all the different infection prevention control practices, using all the different tools that we have, whether, like you said, it was research, provincial guidelines, and also knowing your resources too when you're in, whether it's your job or your placement, knowing how to contact the IPAC unit, knowing what their healthcare institutions' own policies. And really, like you mentioned earlier before, this is an ongoing learning process. There's so many nuances that come up, and to always continue to educate yourself on infection prevention and control practices. So we've reached the end of this episode of Breaking the Chain with Caitlin. Thank you to our guest, Czarielle, for sharing your experiences as a nursing student. And thank you to all the listeners for tuning in. Until next time.